TransForce expander is a fixed appliance that provides slow expansion to widen the arch, create space for the permanent teeth to erupt, and create better arch form. It can be used on the upper arch, the lower arch, or both arches at the same time. This appliance was based on an older appliance called the E-arch. Open coil spring was the force used to expand the arch. The TransForce expander has a spring-loaded piston as its active force to develop the arch. The TransForce expander has many advantages and features that you don't find in other fixed expanders. It eliminates the need for compliance because it is self-activating. The patient does not need to turn any screws, and the doctor does not need to bend any wire to generate the force. And the amount of expansion is determined by a model analysis that is provided for you. When the appliance is returned to you, it is pre-activated and ready for you to insert. You may want to tie this appliance with floss to make it easier to insert. Once it's cemented, you can cut the floss to allow the activation to begin. It usually takes about 3 to 4 months for the appliance to fully expand. You may need to place a small composite ledge on the lingual of the premolars in order to hold the appliance in place, help direct the force of the appliance, and prevent the appliance from riding up the lingual of the posterior teeth. This appliance fits into horizontal sheaths on the molar bands. If you need to remove it from the bands for any reason, the doctor can remove it, but the patient cannot. A holding appliance can be inserted into the sheaths as a retainer once the expansion is completed. The TransForce expander can be used in the upper or the lower arch. It's excellent for non-compliant patients. Since it is pre-activated, you do not need to make any adjustments to get the expansion you need. This is a great alternative for any type of upper and lower fixed expansion that is needed.